Welcome to MenoLabs Live. Today we're getting personal and we're going to dive into a topic on all of our minds: sexual wellness during perimenopause and menopause. Now, in our MenoLife Facebook group, there have been tons of questions and discussions around the topic, and I'm so excited to get answers today from our guest, Dr. Denisha Potter. I'm going to read off her credentials here. She's a double certified OBGYN in lifestyle medicine and menopause, sexual medicine and women's wellness doctor who has attended the International Society for the Study for Women's Sexual Health, which is also referred to as ISWISH. Now we're going to dive more into that, what ISWISH is and all of that later. But as always, this session should not be considered medical advice and is being provided for information purposes only. It is not intended to substitute professional medical advice, diagnosis, or treatment. Please consult with your healthcare provider should you have any questions or concerns. Now that we're done with that, I'm really excited. I'm going to invite in our guests, but I'd love for you guys, all of the viewers out there that are watching right now, I'd love for you to share what stage of your menopause journey you're in. I am in perimenopause. Now there's peri, and then there's menopause, or some people like to say postmenopause. So you can share what stage that you're in. I love for us to share these types of things. And I actually see Dr. Denisha right now, so I'm going to invite her in. And then we will get getting, let me see, maybe I have to invite you, and I thought I had you join, but there, accepting. Let's see. Is it, oh, it seems like there's a delay now. Let me just see again. Is it working? I'm inviting you now, Dr. Denisha. Let's see if that works instead. It always seems to be a little bit of a delay. I'm inviting you, Dr. Denisha, if you hear me. I think you just need to accept. I've accepted you on both sides, so let's see which one works better. I'm really excited. We're going to be talking about sexual wellness today during perimenopause and menopause with Dr. Denisha Potter. And it's saying you're unable to join for some reason. Maybe try and see, make sure you're following MenoLabs. Maybe that's making it so it's not working. There it goes. Oh, she's here. Dr. Denisha, you there?
Hi, yeah, I'm here. Let me just switch this. Oop.
Okay.
Ah,
Great. Welcome. My name is Natasha. I'm the community manager for MenoLabs, and this is our guest today, Dr. Denisha Potter. Welcome, Dr. Denisha. What are you drinking today?
oh, thanks so much for having me, Natasha. I'm so excited to be here. I'm just drinking some water.
Cheers to that. I'm drinking water as well. Well, let's get started. Dr. Denisha, can you share with our community the work you're doing around the perimenopause and menopause space and what you're doing and what you've done in the past with ISWISH?
Yeah. So I am a board certified OBGYN. I'm actually double board certified in gynecology and in lifestyle medicine. And with that, currently my practice focuses on menopause, perimenopause, and sexual medicine. I'm also a member of the ISWISH, or the International Society for the Study of Women's Sexual Health, and I'm a certified menopause provider by the Menopause Society. So with all of that, I mostly treat, manage symptoms of midlife, definitely menopausal symptoms, but sexual medicine and sexual health as well. Yeah.
Which we all need help with. And just speaking about that, perimenopause can bring significant changes to a woman's sexual health, from low libido to painful sex. How can women prepare their mind and body for these shifts in their sexual well-being during this stage?
Yeah, so that's a great question. And I think the first thing is education. Education is number one. So knowing what's going on with your body can go a very long way. So definitely at this time in life, you can have hormonal shifts. And with the hormonal shifts, that can bring some vaginal dryness. You can have some decreased libido or decreased desire. So knowing what's going on with your body, seeking a provider or a specialist who can help you navigate these waters, and knowing that there are treatment options out there that could make you feel better, make your symptoms better, and kind of increase that vitality as well.
Definitely. And then I know we discussed this earlier about our MenoLife Facebook group. Many women in our Facebook group share that their husbands are wanting to be very active during this time, which isn't a bad thing. But if sex is painful or you're not in the mood, what can be done?
Yeah, that's a very great question. And I think that one of the first things we talked about education. So certainly educating yourself, educating your partner, but communication is key here, right? So we need to communicate and let your partner know what's going on. Let them know about the changes that are going on in your body, in yourself, and knowing that there are, again, options out there, seeking help, whether it's from a menopause specialist, a sexual medicine specialist, or even a sex therapist. A sex therapist can be very well utilized here. You can go alone or you can go as a couple to couples therapy to help navigate that conversation, and things that you may not be comfortable talking about. It's nice to have that open space, that judgment-free zone where you can bring it up, you can talk about it, and kind of just get some language and some utilization of different treatment options as well.
And I love you for referencing these two locations where you can get a menopause specialist
Yeah.
and you can get a sex therapist specialist, I guess you'd say. So, can we just share really quick? We're going to have these provided in the YouTube comment section and then on our blog. But where can women find those like sex therapists, menopause specialists? Because it's hard to find them right now.
Yeah. So with a menopause specialist, the go-to would be the Menopause Society, which is menopause.org. So you would go there and look at the Find a Provider tab, and with that, you can find someone with in your area. Same thing with ISWISH, so the International Society for the Study of Women's Sexual Health. With that, they also have a Find a Provider tab. So you can go there and find someone. Sometimes there's an overlap between a menopause specialist and a sexual medicine specialist, similar to myself. So you may have someone that are very versed in both, and there are people out there. That's great. ASET. So that's a society for the sexual therapists and counselors. So with that, you can also find a provider in your area with sex therapy, sex education, so to kind of navigate those waters as well. So there are many different options out there where you can find a provider, and it's great because they list it in your area, local to you, and also with the utilization of telehealth now. So that's very big. So you can use that as well.
So people can feel lost in this, stage in life because sometimes their doctors don't understand. They're embarrassed to ask questions. So it's just so good to know that there are resources out there to find
Yeah.
specialists that can answer and direct you in the right direction. I've read that staying sexually active is encouraged because vaginal dryness and pain can worsen during this stage in life. Is there truth to this?
So there could be some truth to this. Certainly, if you're sexually active, then that helps utilization of those tissues, bring more blood flow to the area, more lubrication to the area, just maintain that sexual health. However, you never want to have sex be more obligatory or just do it just because and it's painful to you. So the idea is, yes, so you definitely want to treat that pain first so that you can have more pleasurable sex. So I would, yes, there is some truth to that, but definitely treat the pain first. And there are different options. If you're having pain more from, you can have tightness of those pelvic floor muscles. So pelvic floor physical therapy may be very helpful to you, or genital urinary syndrome of menopause, where you may need some vaginal estrogen or vaginal DHEA. But again, there are treatment options out there. Treat the pain first so you can have more pleasurable sex.
And I think I've talked about this before on the show, but vaginal estrogen is something that you can see results fairly quickly, but you do have to keep using it if you want to keep those results, right? You have to be pretty consistent with it.
Yes. So generally, and it doesn't have to be the same for everyone, but generally we start with the initial dose, which is every night for about 2 weeks, and then a maintenance dose would be 2 to 3 times for the week, depending on what your symptoms are. But yes, you do have to continue to use it, but it's safe to use for everyone. It's safe to use for everyone. Yeah.
It's so good to know. And then I know you just spoke about pleasure. I wanted to kind of speak on that a little further. What is the benefit of pleasure?
Yeah. So there's so many benefits of pleasure. And it's important to know that sexual wellness is part of your overall wellness. So in terms of pleasure, it can increase your mood, right? It releases those feel-good hormones like oxytocin or endorphins. Certainly, if this is partnered sex, then you can have increase in that intimacy. It can also help you sleep better. It can help it can help boost your immune system. So there are many, many benefits. So if it's important to know in terms of wellness, yes, pleasure is great, but it also can benefit outside of just pleasure during that moment. Yeah.
And it seems like it's tied to other symptoms during perimenopause and menopause, like mood changes, sleep. So all of this is kind of connected in a way. It's like the circle of life, kind of. So it's interesting that you're saying that. Studies show that many women initiate divorces during this time. It's
Yeah.
interesting because recently many films and series like Good Luck to You, Leo Grande, Baby Girl, Dying for Sex, and books like All Fours have highlighted women with younger men during perimenopause and menopause. What do you think the connection is here?
Yeah.
And if there is one?
Yeah, no, I think for sure there's one. Usually we see as the hormones shift, women are just more coming more into themselves, right? You're
Mhm.
just reevaluating your life and things, whether it's a relationship, whether it's a career, you're just reevaluating your life, asking questions like, what do I truly want? For many women, they've just been caregivers for so long, more people pleasing, really pushing their self-care to the side. And now it's a time of resurgence. Yes, I want to care for myself now. And I think that, others are seeing that. So men are definitely seeing this as well, that new confidence,
Yeah,
whether it's older men or even younger men, we're just more
it's true.
confident. Yeah, and also midlife women, they're more no nonsense, right? So they'll tell, there's no guessing for what they want. They'll tell you, right? So even with younger men, we're seeing more culturally that yes, it's like women are can still be desired. They can still want and receive pleasure at this time, and it's wonderful, and they're desired.
I love all of that. So empowering. Speaking of studies, we know they spent a lot of time on men's sexual wellness and created Viagra. And we've all seen ads all over the place for that. Has the same been done for women?
Yeah, the short answer is no, and you're right. There are ads everywhere. I think I heard two on my drive in to the office this morning.
It's crazy.
Yeah, the short answer is no. Women's sexual health is very under researched and underfunded. But they are making some moves, but very, very slowly. Viagra came out, I believe, in like 1998, so the later 1990s, and now I believe exactly, so many, many years ago, and now we have about 29 different medications for male sexual
Yeah.
dysfunction.
So it's
Exactly.
not just Viagra, it's more
There,
options.
there are many. There are many, many, yes. So they have lots of options.
Crazy.
Whereas for women, not many. So there are two. So when we talk about decreased desire or hypoactive sexual desire disorder, there are two medications available. And the first one was approved in 2015. So many, many years after that,
Yes.
1998. Exactly, right? And the second one was in 2019. And we only have two. We can definitely use testosterone off label, but there are two FDA approved medications, but more fairly recent. And even when the one came out in 2015, you had to jump through hoops to just to get that, right? So yes, very under researched, very underfunded. They are making some moves, and ISWISH is very
Mhm.
passionate about this to kind of get that research going so we have more options for women. So we're making some strides, but very slowly.
Yeah, we have a lot to do. This can be an uncomfortable topic to bring up with your doctor and maybe even your spouse or partner. Do you recommend working with a sexual therapist? I know we talked about it a little bit earlier, but if we can dive deeper into that.
Yeah, yeah, I definitely recommend that, and that's generally one way that I start in my practice, right? To just give you the language. So even if it's one visit, to kind of bridge that gap and give you the language to go to your partner, even with your doctor. So if your doctor isn't well versed in this or have a lot of background or education in terms of sexual medicine, what do I ask for? What do
Yeah.
I say? Because sometimes the provider as well, because they don't know, they may just need some guidance as to what to do or what next steps are. So going to a sex therapist who's trained in this is a great way to start. And again, it doesn't have to be with a partner. You can go alone. You can definitely go alone. And sometimes it's helpful for that couples therapy to go together just to facilitate that communication.
Really good. We love to share items to add to your Peri toolkit here at MenoLabs. And today we want to give ideas for a Peri pleasure toolkit. So what items would you recommend that women add to their Peri pleasure toolkit?
So for a peri-pleasure toolkit, I would probably do a vaginal moisturizer and a vaginal lubricant, right? So to start with that weekly or every other night, you can use the vaginal moisturizer and the lubricant with sex. Silicone based ones are generally my favorite. You can also do pelvic floor exercisers like an LV, something like that, just to help that strength, and also for dilators as well to help that tone and to maintain the health of the vaginal tissues. You would have to get it from your provider, but vaginal estrogen, especially again, if you're suffering from that genital urinary syndrome of menopause or the DHEA may be very helpful here. And a vibrator for pleasure, but to also maintain the health, and the blood flow to the vaginal tissues. So
This
that's
is
what I would.
almost making me feel like it's a pleasure kind of wellness routine because you have to kind of work this in. It sounds like all of these are kind of things that you can use on a daily, weekly basis, which I think is great. I imagine that Ishwish, I said it wrong earlier, highlights the best of the best.
Yeah.
What are some new tools and toys that women can check out that you've seen recently at their
So now,
events?
because not just at Ipswich, but everywhere, AI is very big, and utilizing that technology is very big. So we can utilize it in the bedroom as well. So they have more smart vibrators that can use biofeedback, so it just gets a sense of what works for you. Even with orgasm, what can work for that stimulation, kind of save that, and then you can use those settings, at a later time. So those smart vibrators are those are very important. You can also have more, again, those pelvic floor exercises. Those are very helpful to maintain the tone of the tissue. You can have air pulse clitoral stimulators. So they pulsatile to the clitoris. So it kind of stimulates the clitoris, which has over 8,000. I read a study that they even had more 10,000 nerve endings. So very stimulating there. They're also, it's not newer, but I don't know if a lot of women know about it, but erotica can be very stimulating as well. You can use, audio erotica like Dipsy, or have written erotica like the Rosie app, very helpful. So there are many, many different options out there when you think about your pleasure in different ways, to stimulate that. Yeah.
Definitely. We're going to be sharing all of these great resources in our blog, so stay tuned. I'm going to have that on our website soon. And now we're going to look into a couple of questions around libido. So can exercise help with libido?
Yes, so exercise can definitely help with libido. Whether you're talking about pelvic floor exercises that you strengthen and relax the pelvic floor, so that would be helpful. Exercise in general, because we talked about before, can increase your mood, right? So it can also help you sleep. You can feel better. You can feel stronger, as a person. You can, in terms of body image, very helpful for that. So exercise definitely helpful for libido, especially because libido, again, it's more mood, right? So when you increase your mood, you can very well increase your libido. Yeah.
And then speaking of mood, how does stress affect libido? So you just said mood can do that, but further on with stress.
Yeah, so stress is probably one of the biggest libido killers. We know whether we're stressed because we didn't sleep well, just work and more fatigue, it decreases your libido. So generally when you're stressed, you're in a more fight and flight, right? You're not more rest and relax and ready to receive pleasure. So I think finding ways to kind of mitigate that stress, very, very helpful when we want to enhance or increase our libido.
Love all of that. And then the last one, how can breath work help with libido?
Yeah, so breath work is great, and I think it's underutilized actually in terms of libido. So with breath work, whether you're doing that intentional breathing, you're stimulating that parasympathetic nervous system to, again, more relaxed rest and receive state. It kind of relaxes everything in your body. Make sure that you're more in your head, you're more in your body, so okay, you're not thinking about a lot of things at this time. You're more centered, so you can receive pleasure. Breath work can really, really help with this. Meditation, even other things like journaling, but just getting more centered and ready to receive. Yeah.
Love that. Let me see if anyone has questions. I've seen a lot of people joining us, so I'd love to see if you guys have any questions around sexual wellness and perimenopause and menopause. It could just be on perimenopause and menopause as well. If you guys have any questions, I don't want to leave that out. But if you guys don't feel comfortable, this is a kind of unique discussion to be having with a group with people you don't know. So if you do not feel comfortable, I'd like to open it up that you could leave us questions with our customer care team via email at customercare@menolabs.com. And we could also open this up again if we have enough questions with Dr. Potter at a later time. I also would like to invite people, because we do have a lot of discussions around this in our MenoLife Facebook group. So you can join us there. Just look up MenoLife and you'll find us there. And we have a lot of community members that share their experiences. And like again, I said, if you'd like to ask questions there, we can bring them up again in another show, or groups of people can respond to you. And then you could just relate with each other and know that you're not alone, because that's a big takeaway, is that you're not alone. Other people are experiencing this. Dr. Potter, did you have anything else? Dr. Denisha, sorry, make it so formal. Do you have anything else you'd like to close out with to share with the community?
No, I just want to say that what we spoke about earlier, just the importance of sexual wellness. And again, if you're having pain, if you have decreased desire, there are options out there for you. But sexual wellness is part of your overall wellness. So definitely focusing on that, seeking help if that's something that, if sexual dysfunction or decreased desire is something that you're dealing with. There's help out there. Go to the Menopause Society. ISWISH, again, very important, and sex therapists are, a great option, a great place to start as well.
And pleasure is paramount, so make sure that's your focus, as Dr. Denisha shared earlier as well. We're going to provide all of these resources in the blog, in the comment section on the YouTube, where we post the replay. So take a look there to be able to follow up. Thank you to Dr. Denisha for joining me today. This has been really great, very eye-opening, a lot of great information. And as I close out, as always, this session should not be considered medical advice, and it's being provided for information purposes only. It is not intended to substitute professional medical advice, diagnosis, or treatment. Please consult with your healthcare provider should you have any questions or concerns. And please join me again on June 10th. We'll be talking about summer skin, so stay tuned. And let me know if you have any questions or want to ask any questions for the next show in our MenoLife Facebook group. So we'll see you there. See
Thanks
you
so
later,
much.
Dr. Denisha.